All right, in your health news, February is American Heart Month, a time where all people can focus on their cardiovascular health, but disparities can run deep when it comes to communities of color. Joining me now to talk more about how a local organization is working to help those in those communities is Fredrick here with the
Black Heart Association.
Black Heart Association. Fredrick Johnson, thank you so much for joining us today. And just tell us real quick, why did you, the Black Heart Association is here in Grand Prairie, but it serves the entire state of Texas.
Correct.
Can you just tell me real fast why you felt like it was so important to focus on this issue and to help those in the Black community with cardiovascular issues?
Absolutely. We started this organization, first of all, because my wife was a 3-time heart attack survivor, and that's why we do the work, or why we started doing the work. And what we discovered as we started our journey back to heart health was that there are some huge disparities when it comes to Black communities and heart issues, cardiovascular issues. Black men are 70% at a higher risk of developing heart failure. Black women are 50% higher risk, with African Americans being 30% more likely to die from cardiovascular disease. So we wanted to make sure that our organization was able to take this information and the screenings out to people who were not necessarily able to access the information or the healthcare system. So we wanted to make sure that we could, take it to them.
Those stats are pretty alarming. Most people don't really understand that this really impacts a certain sect of our communities here. And you guys have a mobile unit that you go
Correct.
out into communities to talk to people about their cardiovascular health. What can you do if you are lacking access to care, or if you're not able to solely think about what you're possibly at risk for just by being in these communities that are suffering?
Yeah. So that's why we call it Vehicle for Change. That's why we're so important to be out in the community, because there are a lot of people who are lacking access. And quite frankly, a lot of people who just don't understand that they are at a higher risk for cardiovascular issues. So we go out to different events. We're out Wednesday through Sunday providing heart health screenings. There's a genetic screening that we offer, a complete lipid panel that we offer, and then we also, most of the time, have our doctor on board with us. So not only are we providing them with the information, providing them with their numbers, we have a physician there who is connecting the dots between what these numbers mean and how they correlate to your heart health, and also giving them tips on how to turn those things around.
Let's talk about Damar Hamlin, because I think everybody remembers that situation.
Absolutely.
Where he collapsed on the field. And you started something new as an initiative called Play with Heart, correct?
Correct.
Tell us what that is and what it really kind of focuses on, because it's more about preventative health.
Absolutely. One of the things that Damar Hamlin's situation did was kind of shed some light on, some national or international light on something that we already know to be true, and that is that athletes a lot of times are an overlooked population when it comes to people thinking that they're at risk of cardiovascular issues. I was an athlete all the way up through college, and I never once can recall having my heart screened as a part of my athletic physical. So we want to, the Play with Heart initiative is an effort for us to link up with these different local school districts, athletic departments, sports organizations, to make sure that these young athletes know where they stand as it pertains to heart health, not just physically, but more on a cellular level, where you stand as far as risk of developing any type of heart issues on the field, along with providing them with some training on CPR, because seconds matter. We want to make sure that if something happens on the field, we don't necessarily have to wait for the medical staff to get there. The man next to you or the young lady next to you is equipped with the opportunity and the ability and the confidence to jump in there and start to work to try to make sure that everything is okay with that athlete.
Awesome. Well, thank you so much, Fredrick Johnson. I appreciate you coming on the show. The Black Heart Association, if you want more information, go to their website.
Yes,
and
blackheartassociation.org.
Thank you so much, Fred. And we will be right back with more weather and news after the break.